everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about cerebral palsy, which we have already started in a different session where we have learned about the meaning of cerebral palsy, what are the risk factors, and the signs and symptoms of cerebral palsy. So to continue with the rest of the topic, it is very important to refer to the first part of the video. So I hope you have already referred to the first part of this topic. Now let us get started. So here in today's session, we will be basically focusing on the types of cerebral palsy and the diagnosis and the management. So first, let us discuss about the types of cerebral palsy. Now, the classification or the types of cerebral palsy can be, done based on several things. So here, the cerebral palsy can be classified according to neurological deficits. The second thing is type of movement involved. The third thing is area of affected limbs, and the fourth one is degree of severity. So these are some of the factors based on which we can classify cerebral palsy. So first let us discuss about the first factor, that is neurological deficit. So here basically what happens, it is based on the extent of brain damage and also the area of brain damage. So here basically we have three major types. That is, the first one is pyramidal, the second one is extrapyramidal, and the third one is mixed. So pyramidal it originates from the motor areas of the cerebral cortex, and the extrapyramidal is something where the basal ganglia and the cerebellum is involved, and in mixed we can see both the pyramidal and extrapyramidal. Well, the second factor is type of movement. So here in type of movement, we have four major types. So the first one is spastic cerebral palsy, which is actually a pyramidal type of cerebral palsy. And then we have athetoid cerebral palsy and ataxic cerebral palsy. Now, these both are extrapyramidal type of cerebral palsy. And last, we have spastic and athetoid cerebral palsy. So this is a kind of mixed cerebral palsy. So first we would discuss about spastic cerebral palsy. So spastic cerebral palsy is the most common type, and in this there will be defect in the cortical motor area or in the pyramidal tract, which causes abnormally strong tonus of certain muscle groups. So first let us see in spastic cerebral palsy what are the signs and symptoms that we can see. So the first thing would be increased muscle tone, tense and contracted muscles. The child will have stiff and jerky movements, and the limbs will be usually underdeveloped, and also there will be increased deep tendon reflexes. Next, we will discuss about athetoid cerebral palsy and ataxic cerebral palsy, which is also a type of extrapyramidal cerebral palsy. Now, this is found in about 30% of patients of all cerebral palsy. And in this, basically, the child will be presented with dyskinesia, tremor, and rigidity. Also, the arms, legs, neck, and trunk might be involved, and mental retardation and deafness might be, it might be found as an associated problem. And then there is spastic and athetoid cerebral palsy, which is also a type of mixed cerebral palsy. So here basically we can see the features of pyramidal and extrapyramidal cerebral palsy, which we have already discussed. So you can understand that here, both the features would be present. Well, so this was based on type of movements. Now the third factor is according to the affected limbs, right? So here affected limbs means there will be plagia or paresis. Now what we mean by plagia or paresis? Now this means paralyzed or weak. So there might be several types of plagia based on which limb is affected and how it is affected. Well, so the first one is paraplegia. Now, paraplegia means the lower part or the lower limbs would be affected here. So, it would be paralyzed or it would be weak. So, the child won't be able to move the lower limbs. And then there is diplegia. Here again, both the sides will be involved. So, both the legs will be involved here. And then there is hemiplegia. In hemiplegia, basically the limbs on only one side will be affected, and we can also see hip and knee contractures, and there might be presence of talipes equinus. And then there is quadriplegia. So in quadriplegia, basically it starts from the neck and then including the trunk, legs, and the arms. All the parts will be affected here. And then there is monoplegia, where only one limb will be affected, and there is also triplegia, where three limbs will be affected. So these both monoplegia and triplegia is extremely rare. And the fourth factor was degree of severity. So based on degree of severity, we can classify cerebral palsy majorly into three types, that is mild, moderate, and severe. So first let us discuss about the mild. So the mild cerebral palsy is basically where there is no requirement for help for assisting them with their impaired ambulation capacity. And the second one is moderate cerebral palsy. So here in moderate cerebral palsy, the most of the cases, that is almost 50% of the cases are moderate cerebral palsy, where there is requirement of help for their impaired ambulation capacity. And then at last there is severe cerebral palsy. So around 30% of the cases are severe cerebral palsy, where there is where the child will be totally incapacitated and the child will be bedridden, so they require help for everything. So that was all about the types. Now let us move on to the diagnosis of cerebral palsy. So here the first thing that we would do is history collection and then physical examination, and after that we can do MRI scan or CT scan and also EEG. And then there are certain lab investigations which can be also done. So I told you about physical examination. So while doing physical examination, basically we focus on two assessment tools. That is, the first one is Peabody Development Motor Skills and the second one is Denver Test 2. So Peabody Development Motor Skills is an in-depth assessment where 6 sub-tests are included. So the first one is reflexes, then the stationary will be checked, the locomotion, also the object manipulation and the grasping power of the child, and along with all these things there is also the visual motor integration and the gross motor and fine motor, and also a total motor will be also checked. And from birth to 5 years of age will be covered. So this is what is Peabody Developmental Motor Skills. And the next one is Denver Test, which is a developmental screening test. So here they cover 4 general functions. The first one is personal social, and the second one is fine motor adaptive, and the third one is language, and the fourth one is gross motor. So the age covered is from birth to 6 years. So this is how they confirm the diagnosis. Now next let us move on to the management or treatment of cerebral palsy. So the therapy treatment include, the first one is physical therapy. So the physical therapy is directed towards a good skeletal alignment for child with spasticity. And it can also help the child with its strength, flexibility, balance, motor development and mobility. And then there is occupational therapies. So in occupational therapy, what they basically do is they work to promote the child's independent participation in daily activities and routines. And then there is speech and language therapy. So here they help the child to improve the child's ability to speak and to speak clearly and communicate using sign language. And then at last there is recreational therapy. So through recreation therapy, they improve their their motor skills, the speech and emotional well-being. Next is about the pharmacological therapy. So in pharmacological therapy, the child will be given with analgesic drug, botulinum toxin type A, then inhaled nitrous or oral midazolam, and also along with these things the child will be given with diazepam and anticonvulsants. So next let us move on to the nursing responsibilities. So in nursing responsibilities or interventions, the first thing that you should do is assessment. So you have to assess the infant for abnormal muscle tones or inability to achieve the milestones and the persistence of neonatal reflexes. And you have to ensure that the child is getting adequate nutrition or caloric intake, and you also have to monitor their body weight properly. And you have to make sure that the child is immunized and it's up to date, because you have to prevent the respiratory illness, for example influenza. And then the next thing would be improving their communication. So how you can improve their communication? You have to examine the response to the communication. You have to use the cards or pictures or whiteboards to facilitate communication. And also you have to involve the family in training a child to communicate. And the next thing is you have to prevent occurrence of aspiration, and whenever the child is eating anything or drinking, you have to provide an upright position or semi-sitting position. And you have to examine their pattern of breathing. And you have to provide security and prevent injury. So as we already know that the child might have seizure and the child does not have proper balance or posture, so you have to keep the child away from harmful objects. And also you have to improve the physical mobility. So you have to make sure that you examine the movements of the joints and muscle tone, and the physiotherapy is going on well. So that was all about the nursing responsibilities when you are taking care of a child with cerebral palsy. So let us conclude our today's topic here. So in today's session, we have discussed about the types of cerebral palsy, and the diagnostic measures, how to diagnose cerebral palsy and what are the management. And then we learned about the nursing responsibilities. So I hope you have got a better insight about the topic. Thank you.